Hi there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Integrative Movement Insider for Facebook Live. I hope you had a great Labor Day weekend if you're here in the United States, and if you're joining us from another part of the world, welcome. Thank you for allowing me to share this information with you and be part of your journey in becoming that specialist that your current clients need and want, and your potential clients will seek out to help them safely and effectively accomplish their health and fitness goals. In this 2-week series, this 4-part series, I've been discussing helping you become that specialist and why medical fitness is the next biggest trend in the industry and how you can take advantage of this trend. Because here's the one thing about this trend. It's not one of those fad things that are going to go away like a lot of the things you see in the industry, and I won't name any names, you've seen them all. However, the population is getting older. We have more individuals that need expertise of someone just like you to help them address and work through issues like chronic tightness and or discomfort, orthopedic issues like joint problems, osteoarthritic changes, spinal stenosis, disc problems of the spine, other joint issues like labral tears, rotator cuff tears, and issues related to not having complete rehab. Many of our patients, most of the clients and patients that come to our office have been to physical therapists, have been to chiropractors, have been to other fitness professionals, massage therapists, and they just haven't gotten the results that they really needed and or wanted. Yeah, they felt better. Yeah, they got some relief, but they weren't getting real solutions and or strategies to help them outside of their sessions with their practitioner. And it doesn't make the practitioner an incomplete practitioner, it just means that the client needed more. That's where you can really fill in that gap. And there's lots of people talking about bridging the gap, but basically what they're doing is they're just training people. They're not actually addressing the client's issues. And that's essentially why we created the integrated movement system, the proprietary system that we developed for our own clients and patients to help them go through 3 phases. Because the first phase of the integrative movement system is what we call and refer to as the discovery phase. And in the discovery phase, what you're looking to discover is your client's history. Those factors, those things that occurred in somebody's life, so the injuries, the surgeries, the traumas, the exercises your client has done or activities they've done or that they're currently doing, or if they have a sedentary lifestyle, the chronic issues that they're experiencing, the medications they're on, the procedures they've had done, even how minimally invasive some of these procedures may be can have dramatic impacts on how your clients are functioning. So you want to identify and discover this information, because then that will help you dictate and direct where you do your assessment, because you may pay attention to things that somebody else ignored because they're just focusing on the client's hip issue or their low back or their shoulder issue, and they weren't really addressing the whole body. And that's where people, our patients and clients, will often say to us, you were the first person to really look at me as a whole individual, to take my entire history into account, to take my whole body into account when you're looking at my low back or my hip. So really finding out and discovering some of those things that other practitioners didn't look at and or address because they're so focused on the primary issue. Because once you identify, the real goal of phase 1 as you go through your assessments is to discover and identify your client's non-optimal and inefficient posture and movement habits. These are the things that lead to chronic compensations and tightness, discomfort, and a lot of those issues that our clients have, the inability to perform at the levels that they need to and or want to. Because once you identify those non-optimal and inefficient posture and movement habits, you move the client into phase 2, the integrative movement system corrective exercise strategy. And this is where you use the principles of the integrative movement system, alignment, breathing, and control, to help your client create their most optimal and their most efficient strategy for posture and movement. You help them create essentially a new set of habits, a more optimal and efficient set of habits. And we use 3 components. Release, you release where the client has myofascial restrictions, adhesions, scar tissue maybe, and or chronic myofascial gripping, which is basically just overactivation of certain muscles for stability and support. Once you release, you activate. You teach your client how to activate a more optimal strategy, to use the right muscles at the right time. And that's why we share so many of these strategies with you during our exercise portion of Facebook Live and through our website. And then finally, we also incorporate education. You want to educate your client on the things they need to do. Body awareness, posture, give them the most appropriate cues to lengthen, let go, widen, to stop gripping so much, and you educate them on the things that they need to do when they leave your session. Because oftentimes, the most important thing you can teach your client is the education piece, the things that your clients need to do outside, independent of your sessions. Because part of your job as a health and fitness professional is to be a coach. And coaching is all about education. This is what you're doing. This is what you're educating your clients on, the things that they need to do to be proactive on outside of your session. Because the last phase, then you take this information from the corrective exercise strategy and you teach them how to integrate this information into the fundamental movement patterns. This is really where the magic happens in the integrated movement system, and what differentiates this approach, the integrated movement system approach to posture and movement, from all the other approaches that are out there in the industry. It's the ability to integrate these concepts, the strategies, the habits, the more optimal and efficient habits you created up here in the corrective exercise strategy, and integrate them into the fundamental movement patterns. Squatting, lunging, bending, rotating, pushing, pulling, gait, balance, and carry patterns. The patterns that your client needs to be competent in and successfully accomplish to safely and effectively accomplish their health and fitness goals. And when you have a principle-based system like the integrated movement system, and you work your client strategically through the 3 phases of the integrated movement system, you become that specialist. You differentiate yourself from the industry, from all those other trainers, all those other specialists that are out there, and you really become your client's go-to specialist, your area's go-to specialist, because there's not enough individuals, I should say there aren't enough individuals using this sort of paradigm and really helping clients work through what we term special populations. Older clients with chronic issues, tightness, discomfort, joint issues, clients coming out of rehab, not fully recuperated or getting back to those things that they need to and or want to do or even love to do, clients returning from joint replacements and need a specialist to help them get to the next level, the individuals that just want safe and effective exercise programs. Medical fitness is the future. That's why we partnered with the Medical Fitness Foundation Network and Foundation. That's why I became a board member of the Medical Fitness Network as well, because I believe so much in Lisa Dougherty's message and the entire message and mission of the Medical Fitness Network, because we have so many clients that need and want expertise, and there aren't enough professionals out there dedicated to learning, educating themselves, and in turn educating and communicating the importance of this information and giving clients real world strategies that work, that are evidence-based, and providing the most applicable strategies for them to help them safely accomplish their health and fitness goals. So I want to thank you so much for allowing us to share this information with you. We're going to be out in San Francisco this weekend doing a half-day pre-con on training clients with osteoarthritic changes of their hip and knee, sharing the integrated movement system approach, the 3-phase approach, taking you through exactly how to walk your client through this process. And I have a very special second part to this Facebook Live. I'm going to be joined by my friend and industry colleague, Mars, and he'll share with you how we've worked him through this process and some of his big aha moments as we worked him through this process. So you can see exactly how we use this process and a real patient, a real client, his experience working with this information and how he shares this information with his own clients, because he's also a fitness professional as well. So thank you again for joining me. Make it a great week. We'll see you later this week on Facebook Live. Janice and I will be coming to you live from California this Friday. Make it a great day. This is Dr. Eben Osar with the Institute for Integrative Health and Fitness Education.